actually short lectures, and the short lecture one is by Dr. Lakshmi Mundkur. She's from Sami Sabinsa Group Limited, Bengaluru, and when they talk about herbal supplements for non-alcoholic steatohepatitis, efficacy, mechanism, and clinical evidence. Dr. Lakshmi, please.
I'm here. I think the slides are taking a little time.
Okay.
Yeah, maybe I can just start with I thank the organizers for giving me this opportunity, and it is a great privilege to talk in the same session as Dr. Talwar and Dr. Kaul, who are pioneers or who are stalwarts in this area. So I come from an industry, so my talk is not going to be on basic science, but I'll try to cover what we have done in the last few years. So I'm taking you away from cancer and going into an area of metabolic diseases.
Cancer is also metabolic.
Yeah, sure, absolutely. But then I'm so a little introduction about our organization. This Sami Sabinsa group was it was established in the year 1988 by Dr. Majid, and he reverse merged it. In fact, it started in New Jersey, USA, and like Indian operations started in 1991, and then in 2003 it was reverse merged, and the Sami group in India became the main component, and the Sabinsa became its subsidiaries. And the Sabinsa we have in all over the globe. And the main, the important point about our industry is we look from optimized cultivation, and we took a lot of efforts into conservation efforts, and we know our responsibility, so we work with local banks, insurance groups, with the local farmers to get our products. So we are quality driven, and we are ISO 17025 accredited, and our manufacturing plants are CGMP compliant. So this month of October is declared as a National Liver Awareness Month. So I thought, why not talk about liver diseases in this particular conference. So coming to the liver, it's the only organ that can completely regenerate. So I'm not going into all these details because all of you here are much more aware than me about the liver probably. Then liver diseases, some of the common liver diseases are the fatty liver. The fatty liver is the accumulation of excess amount of fat in the liver, and this perhaps is present in almost every individual to some extent. May not be to a great level, but some extent of fat accumulation is there in every normal individual. Then hepatitis, then cirrhosis and liver cancer, of course, is these are the common diseases of the liver. Now the markers are, of course, the liver enzymes, bilirubin, alkaline phosphatase. And then coming to the non-alcoholic fatty liver disease, what is it? So as the name suggests, non-alcoholic, so it's not driven by alcohol. So in the absence of alcohol, when fat builds up in the liver, so that is characterized as non-alcoholic fatty liver disease. Now this is in the early stages of the disease, it is just the fat accumulation, which probably is not too much of an issue. But if it starts progressing into an inflammatory stage, then it is known as steatohepatitis, which is known as NASH, and then the chronic condition, it can go further into cirrhosis and liver cancer also, which becomes very difficult to cure, and transplantation becomes the only option. Now I'm trying to tell you what are the risk factors for NASH. Obesity, of course, is one of the major factors. Overweight, like when you put on weight and fat starts getting accumulated into your liver. Now type 2 diabetes, insulin resistance, PCOS, underactive thyroid, all these could be some of the cause factors for developing NaFLD. Now, as I told you, it could be a simple fatty liver to start with, then goes on to develop NASH, fibrosis, and then the cirrhosis of liver. So, if you look at the progression, NaFLD is present in almost 15 to 25% of the people, and out of that around 40% develop NASH, and then out of that 20% go on to develop the fibrosis and then the cirrhosis, and then it is the hepatocellular cancer. Now if you look at the prevalence, now it was around 25% maybe 6-7 years back, but now it has reached to a stage where in USA 47, almost close to 50% of the people have NaFLD. So it's alarming increase in the disease, which I think we should look into, because it's a silent disease. There is no manifestation which is happening, so you probably don't even realize that I have the disease unless you go to the later stages. So what is the pathology? The pathology is lipid accumulation, that is mainly because of fatty acid uptake and VLDL export is inhibited. So, and then de novo lipogenesis and fatty oxidations are inhibited. Then comes the inflammation part, the macrophages which get activated, and then they start secreting some of the inflammatory markers which activate the hepatic stellate cells, and hepatic stellate cells are the ones which will this is an EMT transformation, like a lot of people have talked about it earlier. So the TGF-SMAD signaling promote the collagen synthesis and ECM deposit. So that is what leads to the fibrotic stage. Now this is just to tell you what happens in this, so I will skip this. And then coming to the treatment, very surprisingly, though it is a disease which is affecting 50% of the population, there are no drugs available in the market. Now lifestyle changes, exercises like caloric restriction, and vitamin E has been used to some extent, and diabetic medications have been used. Metformin is known to have some effect on NASH. Now the drugs which are in the pipeline are targeting lipid metabolism pathways, and obeticholic acid is one promising drug which is in the phase 3 trial. Insulin sensitizers are being used, and GLP peptide receptor agonists are also being used for the treatment, but all these are in the experimental stage. Nothing has been approved by FDA. Now coming to alternate therapy, yes, there are plenty of phytochemicals which are being tried in the preclinical stage. There are not many clinical studies, but preclinical, a lot of these polyphenols have been used. Some of them being stilbenes like resveratrol, the flavonoids, the anthocyanins and quercetin and all that, phenolic acids, lignans and curcuminoids of course have been experimentally proven to help in NASH. Now we wanted to look at this with a combination therapy. Now curcuminoids is already known, it is known to help in regulating the fat metabolism. And then we have had some data on this particular plant, Garcinia indica. It is nothing but kokum which is available in the coastal regions of our country. So kokum is a fruit, and the juice of it is being taken in Goa and Mangalore as a mainly in summer to reduce your heat. So we isolated one particular compound from this Garcinia indica, which is known as garcinol. Garcinol is so I'll come to it. So curcumin, all of you know, it's one of the well-studied molecule. So what we have is a 95% curcuminoids. So coming to curcuminoids, it's not a single molecule. So though we talk about curcuminoids as a single molecule, it has 3 different polyphenols. It is curcumin, D-methoxycurcumin and bis-D-methoxycurcumin in a particular ratio. And that is what is the curcumin that we normally talk about. So this plus the garcinol that we isolated, and the garcinol is standardized for 20% final, because we purify it to 80% and then bring it back to 20% because that is the one which is stable. And we use piperine or piperine at a very low concentration as a bioavailability enhancer. So now we did some in vitro studies, in animal studies, and then the clinical studies. So I'll take you through, I won't go into the details of anything, try to finish my talk in 20 minutes. So we did this I'm not talking about the in vitro studies, I'll directly go on to the in vivo studies. This was NASH fibrosis model, which we did along with SMC labs in Japan. Now this is a model which closely resembles what happens in the human condition. Now in this, the 2-day-old mice is given the first hit, which is the streptozotocin to induce beta cell injury. And then from 5 to 6 weeks onwards, the mice are kept in high fat diet. Now if you look at, there are different stages of this. So up to 5 to 6 weeks you start steatosis appearing, then it is the steatohepatitis state, and then the fibrosis, and then the so it follows the disease pattern which is seen in human. So we stopped our assay after the 9th week because we didn't want to go to the later stages, we were looking at the early stages of the disease. So this was the protocol we followed. So just to tell you that we used curcumin C3 complex alone, and we used the garcinol alone, and then we combined garcinol and curcumin. So if you look at this, the first is the NAFLD activity score, which is based on the histological sections which are stained with hematoxylin and eosin. So if you look at the data, the combination was significant compared to the both curcumin and garcinol alone. So and then the steatosis score also came down, and also the ballooning. Ballooning is something which happens in the liver. Like maybe the next slide will show you the ballooning much clearly. If you look at the first one, you can see that the cells are bulged. So this is known as the bulging of hepatocytes, and the bulging came down when we treated them with the combination. And also this is stained with the collagen staining, which is done by picrocereus red. You can see all those red stains are the picrocereus one. So the collagen level also came down. Now then the precursor for collagen is liver hydroxyproline, which was estimated, and curcumin and the combination were able to reduce liver hydroxyproline. And when we looked at the gene expression based on the fold changes, the TGF beta and collagen 1 levels were lower. Now then we looked at the TNF alpha in the liver tissue, where we had lower level of TGF alpha both in curcumin and in the combination, and that was probably mediated by the NF-kappa B phosphorylation. Now then we went on to look at some of the biomarkers. One of the main one was the adiponectin and the FGF resistance which develops in NAFLD patients. So we had the curcumin was not very effective in adiponectin, but garcinol was little better than the combination actually. And then, but FGF resistance was brought down by the combination. Then of course, since both of them are antioxidants, there was a reduction in most of the markers of antioxidants. So in conclusion, we can say that garcinol is able to reduce hydroxyproline, decreasing the trend for TGF beta, collagen, fibrosis, but the combination has significant decrease in both fibrosis as well as the NAFLD activity score. So we published this data, all the in vivo data, and then we went on to do the clinical validation. So the garcinol, curcuminoids and piperine, so we call this GCP, or our trademark for this is live longer. Now clinical study was done, it's a preliminary clinical study which was done as a two-arm randomized double-blind placebo-controlled study, and garcinol was at 50 milligram and curcuminoids were 250 with 5 milligram of piperine or piperine as bioavailability enhancer. These were male and female patients up 30 to 65 years who were diagnosed for NASH based on elevated liver enzymes and ultrasonography. Then they were obviously having a higher BMI, and then GCP was given twice daily. for 90 days. And apart from the intervention, we also ask the participants to refrain from taking any processed food and not have junk food and have 30 minutes of exercise every day. So the primary objective was to look at mean change in liver enzymes and then the liver fat content, which we measured by using a fibroscan. Fibroscan is one of the recent development in the diagnosis of NASH. So which measures both the steatosis or the accumulation of fat as well as your stiffness. The stiffness talks about the fibrosis in the liver. So we looked at that as one of the markers. Now secondary objectives were the lipid profile, the glycemic profile, the biomarkers, and then changing BMI, the weight, and then the of course the safety was one of the major concern, which was the secondary endpoint. So I am not showing you all the data because this our clinical study is yet to be published. So I will show you some of the important data, which is the reduction in AST and ALT in GCP or the treated patients compared to the placebo. Then the liver stiffness and fat deposition. So this is a non-invasive technique. So the FAST score, which is becoming very important in looking at the liver stiffness and steatosis, this score is developed by using the fibroscan data on your steatosis. Yeah, this is one of the last slides. I am not taking too much time. So the body weight, there was a reduction, the waist circumference there is a reduction, and adiponectin was increased, and while IL-6 showed a good reduction here. So again, when we come to safety, GCP was it did not cause any changes in the serum, any of the hematology or other markers, and it is a safe nutrient for consumption. So we have also done the preclinical safety for this molecule. So all the GLP studies have been done to show that it is safe for human consumption. So I think I should thank you for your patient listening, and if there are any questions, you can.
Thank you very much for the talk. And I have one question.
Yeah, sure.
So in your GCP trial,
yes, sir.
What are the inclusion and exclusion criteria?
So I think it was there in one of the slides. I didn't go into the details. Yeah, the main inclusion criteria was they needed to have a NASH which was diagnosed by the liver enzymes and the ultrasonography, and the stage of liver steatosis was less than, the grade was 2. We didn't take something mild to moderate NASH. We did not take the severe cases.
And mode of delivery? Oral? Is oral delivery? Or?
It is oral delivery. It's an oral.
So how do you know the absorption capacity?
I agree with you. Because of lack of time, we cannot go on and on. I just wanted to make just one remark, and that is that NAFLD is now being called as NAFLD.
Yes.
It is a metabolic associated fatty liver disease. But I mean, there are quite a few things that I had in my mind.